What tumor?
So where is the tumor?
That's a heart. In the kidneys?
No.
Not the heart, not the kidneys.
The lungs, right?
The lungs.
Yes.
So it
Lesions on
causes
lungs.
pulmonary adenomatosis or pulmonary adenocarcinoma. So if you see a tumor in the lung of a sheep, we want to check for this virus. And there's another, and we actually have examples of this when we do lab today, but there's another type D retrovirus that affects sheep. Y'all know where the tumor is in that one? It's not Yaxiothi, it's just, they're kind of anagenically related. So ethmoid tumor, I heard about that one. And zoonotic ethmoid tumor, so that's another one. All right, are there any questions? All right, so we'll move on. Okay. This is probably one of my favorites. I love talking about clinical relevance and stuff. Thank you for that cough drop. It really helped. Appreciate it. Okay. So now we're kind of going to talk about the clinical considerations in veterinary medicine with neoplasms, or like. Okay. So some of the risk factors involved in the development of cancer include geographical location. You're around a lot of asbestos or pollution. All that comes into play. Age, older beings are more likely to get cancer than younger, but that's not always the case. We know there's pediatric oncology for a reason. The environment and heredity. Sometimes you're just predisposed. Okay, so like the same thing we just said. So heredity, age, gender, pigmentation or lack thereof for some cancers, hormones, chronic irritation, and parasites. Most cancers are in older individuals. The reason you see it more so in our dogs and cats is because they're allowed to live out their lifespan rather than like pigs and cows or food animals. The incidence of neoplasia will increase in the third trimester of life. So there are some tumors that younger animals are predisposed to. In the case of dogs, in dogs less than 6 months of age, they have a higher incidence of hematopoietic neoplasms, skin tumors, and brain tumors compared to older. So mast cell tumors is something that you don't hear about that much in human medicine, but in dogs particularly, it's very common. Other animals can get it too, it's just common in the dog, so that's something you're very likely to see in practice. Cytology is a great way to have a presumptive diagnosis of that. So with mast cell tumors, what do you expect to see under cytology?
What's in the mast cells?
What's in the mast cell?
It's granules.
Granules, yes. You'll see, so that's probably the easiest thing to diagnose. But in dogs, so that's great for presumptive diagnosis, but then you need to grade it. So even if you diagnose it as a mast cell tumor, you still want to take it off and submit it for a biopsy, so you can give it a grade. And we're going to talk about staging and grading. In cats and cows, lymphoid neoplasia is most common. So the most common tumor in a cat is lymphoma. The most common tumor in a cow is lymphoma. Mesotheliomas have a relatively high incidence in neonatal calves. And cutaneous neoplasms are common in young horses. What's her name? What's the lady's name? Vicky. Is it Vicky?
Yeah.
Yeah. So she was telling me that she had a foal, like 2 weeks or 2 months old, that ended up getting hemangiosarcoma on the leg. So, I mean, I've never seen a case like that, but cutaneous neoplasms in general are common in younger horses. So these are some breed predispositions that you need to know. So boxers, who has a boxer? They get every fabric. Yes, they do. And every tumor, they're like little tumor factories. So take it off when they get them. Not that I'm wishing them to get them, but it's just something that happens. And thankfully, sometimes they're just benign, you just cut them off and they go their merry way. And they're so sweet. German Shepherds have a higher predisposition to develop hemangiosarcoma. Where is hemangiosarcoma likely to occur? Spleen. And where else? And the right atrium of the heart. Those are your two most common originating sites. So spleen and the right atrium of the heart. And of course, it can metastasize to the liver. And it can be anywhere. Anywhere, because you got blood vessels everywhere. But large breed dogs are predisposed to osteosarcoma. Very, very, very common. Just an example of osteosarcoma. I thought there was something else. Well, we're going to talk about that in the lab today. Brachycephalic breeds, fish-faced dogs, are most predisposed to develop CNS tumors and aortic body tumors. Y'all know what aortic body tumor is?
It's in the aorta.
So you have like baroreceptors in the aorta near the base of the heart, and the aortic body tumor is also called hemodectoma. Okay, so that's what it is. Everybody got that? Hemodectoma, aortic body tumor, base of the heart. Sinclair and Hormel miniature pigs and Duroc Jersey swines predisposed to develop melanomas. The cool thing is they are commonly congenital and they commonly regress. But breeds that are predisposed to this are used as animal models for human melanoma. Even though they're less than ideal because they come at birth and they regress, but because they're so likely to develop them, you kind of use what you have to work with. And this is very important because this is so characteristic for this breed, and it's a genetic predisposition. They actually have a gene bank because they're trying to figure out why these dogs are so predisposed to develop malignant histiocytosis. So Bernese Mountain Dogs get malignant histiocytosis, or you could say histiocytic sarcomas. Malignant histiocytosis is the term given because it's so widespread rather than just like a mass on the leg. But they're multiple histiocytic sarcomas. Okay, everybody got that? That's not the 8:50, right? No, 9 o'clock. Okay, so large breed species predisposition. Cattle and horses, granulosal thickle cell tumor. So where is that located? The ovary. If you see a tumor in a horse ovary, it's probably going to be a granulosal thickle cell tumor. They're very common in that species. A lot of times they'll present with nymphomania. They'll have like the females will present with stallion behavior, which is really cool to me because granulosa cells normally secrete what hormone? Estrogen. But in these cases, not all the time, but a lot of times you actually have elevated testosterone. So the common or the pathognomonic, the characteristic histologic lesion or finding associated with this is they look like a little rosette of cells, and they're called Call-Exner bodies. That's capital C-A-L, capital E-X-N-E-R. Okay, so histologically, that's something you can see. Yes.
I don't know if I'm just trying trying to think about it as far as the granulosa beta cell tumors.
Mhm.
Is it they have stallion-like behavior because of beta cells produce testosterone?
No, your fecal cells don't produce testosterone. I'm not sure exactly of the mechanism of why. I really don't know. I don't know if they transform to produce more testosterone instead of estrogen. I don't know if, if there's expression of, or lack of expression of the enzyme that causes testosterone to become estrogen, like maybe they have decreased aromatase. I really never looked it up, but I should. I'll look that up. I don't know why. So fecal cells actually produce progesterone, okay, and Leydig cells produce testosterone in the normal ovary. Let's see, okay? And I'll try to, if I have time before we meet today, get some histological images of that so you can see what I'm saying about the call extra bodies. It's just your characteristic thing to say, oh, this is a granulosa fecal cell, or granulosa cell tumor. So cats and cattle get lymphoma. So they can get spontaneous lymphoma, but one of the reasons they're predisposed is because they are susceptible to the two viruses that cause lymphoma. And what do these stand for? Feline leukemia virus, bovine leukemia virus. So you don't have to have that to have tumors, but because they get that, and many of the animals that are infected with feline leukemia virus or bovine leukemia virus don't get neoplasms. But if I have a cat or bovine and I see lymphoma, you want to test for that. Cats get feline vaccine site-associated sarcomas. It's a pretty big deal because when they get them, fibrosarcomas in general are very, very infiltrative and hard to remove. Even if they're not that malignant, like they're not that aggressive, just the fact that they're very infiltrative makes them a little dangerous, which is why we stopped giving cats their vaccines between their shoulder blades. Because, and it's not a huge percent of cats that get this, but we would see the cats get this, but then you couldn't get it out because it's in between the shoulder blades. So that's why now our vaccines are at on our distal limbs, so if they do get a tumor, it's easy to remove or to ambulate the leg if necessary. Horses, the most common tumor in a horse is a sarcoid. They also get pedunculated lipomas. Do y'all know where these are located? Horse people? Nobody's a horse person? Oh man, I love horses. So it's in the mesentery. So it's going to be in the abdomen. So it's very common when we open up a horse's abdomen to find these little lipomas, and they're just benign tumors, but they tend to sometimes be pedunculated, meaning they're on like a little stalk off of the mesentery, and so if that stalk gets long, it can wrap around the intestines and cause strangulation, and then you have a strangulating lipoma. So that's where the damage comes from. In dogs, mammary gland neoplasia is very common. And in chickens, we talked about Barrett's disease, which is caused by the herpes virus. Alright. So this is a granulosa fecal cell tumor, or granulosa cell tumor, and this is leukemia. So here, this is like the little normal lymphocyte, and you have these big old cells they look like lymphocytes because why? What about this cell tells you, even though it's huge, that it's probably of lymphoid origin? Huh? Yes. So decreased, so you have a large nuclear to cytoplasmic ratio around nucleus and a little bit of cytoplasm. So that would push me to think it's probably lymphoid. Try the time, 5 more minutes. So pigmentation and parasites. So white-coated animals are predisposed to develop squamous cell carcinoma. Commonly, what's the breed that has the white face? Cow. What breed of cow has a white face? Hereford. So Herefords very commonly get squamous cell carcinomas around their eyes. or any animal that lacks pigment is predisposed to develop neoplasia, particularly associated with the sun, and squamous cell carcinoma in animals, that happens to be what they most likely get. Unlike humans, which more commonly get melanomas, animals more commonly get squamous cell carcinomas associated with excessive sun exposure. And you actually can put sunscreen on like your white-coated animals to help minimize them from getting sun damage. Gray horses are predisposed to develop melanomas. The most common originating site is in the where?
Perineum.
Perineum, right beneath the tail. I've seen that so many times. I've seen it just invade like the brain, the bone, so it can be very aggressive. The most common parasite associated neoplasm that you're going to learn about in veterinary medicine is going to be sarcomas associated with the parasite Spira cercoloupi, which kind of migrates through the aorta into the esophagus. So you can either get an aortic granuloma or an aortic neoplasm, like in the wall of the aorta, but more commonly you're going to see about it in the wall of the esophagus. And it can be any tumor, it can be, but commonly it's fibrosarcoma or sarcoma associated neoplasm. And chronic inflammation in general can result in neoplasms because it's like your cells are constantly trying to fix themselves. So you just, in my mind anyway, it's like you're constantly having more opportunities to have mutations. Okay, hormones can play a major role in tumor development. We talked about one tumor that is associated with excess androgen production. And what tumor was that? The tumor associated with, in male dogs, usually associated with excessive androgen production. Not anal. So I remember what happened is I was showing an image and talking about anal gland adenocarcinoma, and someone asked that question somewhere back there. I don't remember who. Huh? The hepatoid adenoma, yes. And what's another name for that? So hepatoid adenoma is kind of the layman's term because the cells look like hepatocytes, but what's a more anatomically correct name? So they're around the anus, circumanal gland adenoma. And that's a very classic hormonally stimulated neoplasm. It can be benign or malignant, but usually it's benign. And castration will like treat it. You take it off and then castrate and no more tumors will develop. Interestingly though, I've had cases from spayed females and I'm like, why are these females getting hepatoid adenoma? So I did a little reading, and because they're spayed, you have excess production of androgens from your wet layer of the adrenal. Zona reticularis, salt, sugar, sex. So that's like the proposed pathogenesis behind why some spayed females get it. But usually it's a male, non-castrated male tumor. Okay, so that's just an example. And of course, females, the classic one associated with hormones is mammary tumors. And it's 9 o'clock. Let me see how many more I have. I don't have much more, but we'll stop here and we'll finish before we start the lab at 1. Any questions?